I'm just laughing because you've lifted the lid off Pandora's box here.
We were ready for this. Nothing's happened. It's quite calm so far, yeah?
Well, I think Jean and I are both reflecting the same thing here. You can't decide these questions in this forum.
No.
You've got to take this offline.
Yeah.
It's important to get this feedback, and clearly this has given you some food for thought. But,
so how would you, we had a meeting.
even if we keep going till
Okay,
next time,
we've had a meeting to discuss this, everyone was invited. We fought this out, we refined the protocol, we got consensus, we went out and come back again. Are we back in the same place? Do we start again?
Yeah.
Well, I mean, my argument would be the one I put before. Do the audit, and then you'll get more consensus.
So what did we achieve?
Your point earlier on was actually very interesting. Are we running a trial looking at applications or a trial looking at ultimate outcomes? Are we looking for positive outcome of the trial or a negative outcome of the trial? What is it's more important?
I'm going to defer to the...
Well, we're going to talk about outcomes in this
Yeah, okay.
Well, because it's not one or the other, it's very balanced.
Right.
I don't want to give the answer to my question, but
Go on.
the purpose of a primary outcome is to inform the sample size of education.
Yes.
What you do is a really big trial.
Yes.
Often the secondary outcomes are actually what we're all most interested in.
I think this is important.
And what you're all saying, all these things are incredibly important, so you need to design the trial. Yes, it's kick-started by a primary outcome,
Yes.
but the key things are all these adverse events and so on. It's not either or, it's both and.
I think that's the key. I think that's exactly what we're trying to do. What we're trying to do.
Can I just go back to the previous comment? Your primary question is, does putting the nail back result in an infection or not? A high infection rate?
Yeah.
That does not have anything to do with appearance, because an infection can be in any part of the finger and may not involve the repair site. And if it doesn't involve the repair site, it doesn't affect the point of appearance. So you can't have to connect the two things. And I think we should be careful about it. If you have an infection at the site of an incision or at the site of a laceration, and it doesn't affect the repair site, it will not affect the appearance of the site.
Yeah, I agree. So should we even care about appearance? That wasn't the initial Ria's goal.
I was just going to say that if you include lacerations and crushes, those are different mechanisms and could ultimately lead to different outcomes. So you've got to, the population and the severity of the
Initially, like, if you're going to be like a proper scientist, which I occasionally try and be, is you want to compare apples and apples. So you want to compare crush injuries with crush injuries because they're the most common. But then we had a discussion about it and we decided, no, we're just going to all comers. We're going to do everything that comes.
You're shaking your head. The trials units, should we include all comers or should we make it very, very focused? Or should we throw it wide? To get engaged with the start first trial.
We're going to be talking about that in the quiz as well.
This around.
So if you want to change clinical practice,
Yeah.
presumably you need to do a pragmatic, very important inclusion criteria trial
That's what we're trying to do.
Lots of mess, lots of chaos, lots of heterogeneity.
Yes.
But it will give you a clear answer that will inform practice.
And the main reason we wanted to look at infection rates, sorry to interrupt you, is because in the St George's study they showed that the patients who had infections had to come back to the clinic on multiple occasions, which costs a lot more money. So the whole point of doing this trial is to try and save money, save the NHS money,
And patient
reduce
travel.
patient travel and all the aggro and everything. So if we can actually do that, then we can kind of justify this intervention because we're going to improve things for patients in terms of patient care. That was the point of it.
Yeah, you see how simple it is? You just flip the nail away. That's not a big deal. Put the nail back, don't put the nail back. If that can influence your outcome, reduce the number of visits, reduce the number of infections, we should all be doing that. Do you agree? But then, you've seen how much headache we're struggling with a nail bed trial. Just imagine we talk about cancer. I'm used to this. We've been toiling for 6 years on this and never get a trial underway.
Yeah.
No, I think the important thing we should be asking one question, not two questions. And the one question is not the repairable outbreak or otherwise. That is a separate
Yeah.
we can give. I think it should be repair. It should be replacement or not replacement of the nail. But the other important thing is that undoubtedly infections become an integral part of the outcome, as you said, because of the dissatisfaction of the parents to have to return to either the GP, multiple visits, and possibly an impact on the appearance. But I don't know how you can separate the primary and the secondary outcomes. I think they're integral.
Yeah, I think they're integral. I think we need to collect them both.
It's getting complicated.
It is. No, it is. It's the problem we're having.
And that's right, and these things always are. But we must go back to the question is the most important thing always. And if we forget infection or not, because that's an outcome. The infection is not the question. The question is, what should you do with these patients who have this pathology? And then you want to pick the best measure for answering that question. And at the moment, you're suggesting that infection is the best measure to do that. It may not be so. And I think that's where the discussion needs to be. If your question, your clinical question, is that we have this intervention, should we do it or not? And let's measure something to see whether it should be done. That's what we need to go. And at the moment, there's so many things in the pot that it's hard to see which is the most
Does
important.
anyone know here of any paper or data that directly attributes infection to poor cosmetic outcome in nail bed injuries?
That's one of the keys.
You don't know that. So we didn't know even if it does. So is that separate? That's
Yes.
Well, Hank Gill tried to address this in the Cochrane.
it's a Cochrane, yeah.
But actually they showed no difference because they showed no difference in infection rates. They also they didn't measure appearance in the trial.
Is that the principle behind the trial, that if you do or don't replace the nail bed, you will get infection, yes or no?
Yes,
That was
that's
the question.
Yes.
Go on. Okay. Come on, you're all invited to this meeting.
This is really
You must
important.
Come on.
It's absolutely critical, this
Yeah.
discussion, so feel free to...
Hand surgeons, let's go on. John.
Sorry, well my basic point was that the term nail bed injury as a first start is a bit of mystery. It's a bit like RSI, it's a bit like other terms. The number of different types of nail bed injury is a plethora of different conditions. So it's a definitive injury and it's a part of that. So it isn't a matrix injury that you're talking about. So your impediment here is quite right to narrow it down to a certain bit, but maybe it should be narrowed down even further because there's still diversity within that.
I don't know is the answer, but I thought if we throw it really wide, and as James here for the slice, James is somewhat here, so what we do, if we throw it really wide and recruit large numbers, maybe that doesn't matter. Charles Eunice, do you think? Do we need to
But also the other thing is that these are children and you don't get to assess the nail bed until you've got them in theatre. So you already have to do your randomisations what you're going to do before you've actually even assessed the injury properly, probably.
Yeah.
Which just makes it a little bit more difficult. So I think we have to take all comers.
Okay.
But yeah, you're right. It's like, if a nail bed injury is just like a little cut in the nail matrix, it's quite different from one where you think it's almost off.
It's quite different to
One more
a
question.
femur fracture, for example.
We're not going to include single fractures.
No, we're not going to do that. One more question.
Just you powered the study to be a definitive trial,
Yeah.
essentially. From the conversations going on, it sounds like actually what we almost need to do is take a step back and do a feasibility trial. Because you've got data from patients saying that that's what's most important to them, and the NIHR listens to that.
Yeah.
So it's very, very difficult to justify why you're not going to do with the patient, particularly for grant trial. So if you were to re-answer it, say our primary outcome is about appearance, and the secondary outcomes are about infection rates, etc. What you could do then is define how a definitive multi-centre trial could run, so that you answer all those questions, because there's so much variation. Because one of the big things I see as a problem is the way that antibiotics are given, whether they're given at the time of injury. Now, most places do that, so that's going to affect your outcome in the end anyway. So what you need to do is have a full protocol that defines when the antibiotics
So that was discussed. Exactly. That's everything from the stage, the techniques, about every single step of the operation is defined at the meeting and has been published online for comment. Okay, I'm going to round up there, but just goes to show nail bed injury. What a headache! What a headache! So it looks like the BSSH thinks it's a good idea. They funded it, but what a headache!
One last comment, if I may have you. I mean, I think that slide epitomises the problem that we're at, because you've got a very clear clinical question and five measures that or 5 things that you want to look at. And dare I say, I agree with Jane on this. We both think that sometimes you possibly can have a dual primary outcome measure, and it might be something that we might want to think about with this particular trial.
Okay, that sounds good to me. Okay, then we move on to the next one now.